And Livia, Inga mentioned you and already showed pictures of you as a family, a parent of a preterm baby. And apparently you were living in Hungary by then. Now you moved to Switzerland, but still you are very much involved in the activities in Hungary. And we are very, very grateful for that. And as I understand, you also have a professional experience of a pediatric cardiac intensive care unit. And that's very challenging environment, of course. You have been very active in the EFC and ICE from the very start. You're also extremely active in the GLANCE project. So please, Livia, tell us about your experience. The floor is yours.
Hungarian experienced NICU parents can initiate changes. Well, as you really good mentioned it, as I'm a Hungarian born in Budapest, but 16 years ago I got married to a French guy. This is my family celebrating Mother's Day in May 2005. French daddy, Hungarian mom, and the 7-year-old little girl. We lived happily as a perfect European model family. And then we decided to have a second child. In Christmas 2005, I got the most beautiful present, the ultrasound result, which revealed that I was pregnant with a little boy. It was a happy and relaxed pregnancy. I was a dream for every gynecologist, a 31-year-old mother who did not smoke, drink, the previous healthy pregnancy, and natural, uncomplicated birth. In the 25th week of my pregnancy, my gynecologist authorized one last flight to let me visit my family in Budapest, Hungary. But two days before I returned to France, I got sick. First, I had a headache, then my legs and arms got heavy and swollen. All of a sudden, I was feeling extremely tired and dragged myself into the closest hospital. I had preeclampsia. Until that moment, I had no idea about preeclampsia at all. I have only vague memories of the next 14 weeks, what happened. And I remember well the emergency doctor who explained to me, to my frightened husband, that 1,300 kilometers away from us, on the phone, that was happening to his wife and his unborn son, and that they would have to deliver the baby immediately. My son was born on the 27th week of the pregnancy with 890 grams. I remember the moment when my son was born and I saw his tiny feet and the neonatologist running away with him as he had no signs of life. And I will never forget the moment when I woke up in intensive care and the pain I felt when I realized that this was not a bad dream, this was the reality, my tummy is empty. My husband rushed to us from France. I will always remember the first time we met our son around 24 hours later after his birth. I tried to prepare myself for the sight of my son, but you cannot prepare for this. 5 days after his birth, the hospital released me and I had to leave my baby there alone. I was devastated. At the same time, my husband had to go back to work to France and took with him our then 8-year-old daughter on the day of her birthday. So I stayed alone in Budapest. The NICU door will haunt me for the rest of my life. I was afraid of what was waiting for me behind that door. For the next 14 weeks, I stood in front of that door twice a day and pressed the bell. Why would they open quickly, or would I need to wait? If I have to wait, was it because something was going wrong on the other side of the door? Was it my son? I insisted on calling the NICU every morning at the same time. And as Mandy mentioned it, every day I wrote down every little detail on his baby journal and also added one photo for every day. It was really important for me. If anything is happening, I need memories. I need to prove his existence. Often I found myself not looking at my baby, but the monitors. I tried to think that this is not my son, to avoid getting too attached to him. I did not want to feel any pain if he would not make it. Although everybody tried to convince me that I had to be happy as I survived, I blame myself for his premature birth. I felt invisible in the hospital. Doctors, nurses were overworked and did not have time for a mother who was depressed. I had no psychological help at all. There were 6-7 incubators for one nurse and 1-2 neonatologists every shift. At that time, I was confident and felt that my baby was in good hands. I had no choice. I couldn't even compare it with anything. Never, not for 1 minute, I questioned that my son and I did not receive the best treatment and care. Now, in hindsight, I know how dangerous this situation was. Every day when I walked into the NICU, I only watched incubator number 23. I was mom 23. The doctors came by, often said some cliche like, my favorite, 2 steps forward, 1 step back, and then they left me alone. The visiting time for each child was 20 minutes, 2 times a day. I remember the exact day and the exact hour when my son started to breathe without any machine. And that moment, he was born the 2nd time, but I wasn't there. They told me on the phone. The moment when I could hold him in my arms for the first time is equally unforgettable. He was 12 weeks old. Then one morning, they told me I can take my son home, and all of a sudden, he was lying there next to me in the bed, a little 2-kilogram baby who was on monitors only a few hours before. I felt completely incompetent and did not dare to sleep for weeks in a row. I had to watch my son during the night, always checking, is he still breathing? After my son got out of the NICU, I felt many things, but I missed the most important feeling. I did not feel like his mother. I felt more like a nurse, as Mandy mentioned also this morning, and did not let anyone near him. When I fed him, I was wearing the green NICU uniform and mask for weeks. It took another 2.5 months until we both could take a flight to come home to France. You cannot imagine the financial burden. For nearly 6 months, we paid 2 household charges, taxi fees, phone, internet, flight tickets, which had absorbed all our reserves. And if you think the roller coaster got easier, usually us parents, we are describing this journey as a roller coaster, what we having in the NICU. We learned that the French and the Swiss social system is extremely weak, and without enough information and a good advisor, you can slip out really easy from it. During follow-up, nobody took my worries, my comments seriously. My son's development was extremely slow. After 2.5 years of pleading for an MRI, they finally gave us a diagnosis. My son has PVL, profound brain damage, equal mentally and physically disabled child. Our son became a fantastic little boy. He's a 5-6 years old child who lives in the body of a 14 years old boy. Now he's 14. He was 14 last week. He walks, he's happy. He speaks 2 languages, French and Hungarian. He has his own friends. And he is the only boy and enjoying every attention of his 3 sisters. But he cannot change his clothes. He's not able to write or read. He will never be an independent adult. He will always need someone around him for 24/7. Every year, more than 8,000 newborns begin their lives in different levels of need throughout Hungary. The pillars of family center care are absent from numerous units. One of the most significant is the access for parents and their involvement in the care of their children. My story is not special in any case. The past 14 years learned a lot about the neonatal practices of domestic and international level, and being part the development as a parent advisor at the EFCNI Standards of Care project, which I'm extremely proud of, and I'm so honored. I cannot thank enough to Silke and her team. Now I dare to say out loud, my son did not get the best practice in Hungary, and France and Switzerland failed during follow-up. Was he the unfortunate little boy who was born in a wrong country, in a wrong city, or in a wrong NICU? No one knows whether my son would be healthy if he was born in France or Switzerland. But 20 minutes visiting time twice a day has definitely not helped to let him thrive. He couldn't benefit from skin-to-skin care, not at all. He wasn't breastfed because I lost my mother's milk after 2 weeks. These may seem simple things, but we know for a long time that these are the things that contribute to making a difference. Because of these differences in care between countries, but even between single hospitals, I started to work voluntarily as the very same NICU still until last year. Continue the harmful practice and give limited time to visit for parents. Couple of hundreds of meters away from that NICU, in the same city in Budapest, 2 other NICUs working 24/7, giving 24/7 access for parents. How is it possible? How can we let such differences happen? How can we provide the best possible care for such vulnerable little children if there are no widely accepted regulations? The first time when Hungarian healthcare professionals heard about the FINE program was in February 2018, when our association organized the 4th Global Summit for Preemies in Budapest. 17 months later, all neonatal units at the east part of Hungary have taken part in the first level of training of FINE and are embarking on the next stage. I think this achievement has been the result of desperate parents as they joined forces, regional parent organizations, as we had similar experiences and still a need for more infant and family-centered care. We got huge support from healthcare professionals, doctors, nurses, and most importantly, hospital directors. Without them, we couldn't make it. For the financial part, because the eastern part of Hungary is the most poorest part of the country. So these regions could get an EU grant. So with this EU grant and with Miskolc, which is in the north part, who is not part of this region, so they couldn't benefit from the grant, it's GE who helped us. And they heard it really quickly that if they're going to help us with the finance, then all the eastern part of Hungary can have, and they will be in the same and equal training. In June 2019, a few months ago, at the Young Neonatologist Conference in Hungary, along with Professor Jackson, Inga made a summary about those 17 months of experiences she worked together with the Hungarian nurses and neonatologists. Jacques gave an insight about experiences working as family-centered care unit in France, the challenges and how they climbed those mountains to make it work. And Inga summed her experiences hard but hopeful. FINE is evidence-based, but lack of access to information, most of which is only available in English, has made it hard for mostly nurses to understand those evidences. So with my fellow parents, all the materials, PP presentations for this training be translated into Hungarian and have been reproduced. I hope that it's a high quality, they are high quality books. I still remember the stress I felt when Inga made the declaration, I need you parents to do some presentations with me. Thoughts were running in my mind. The nurses, but most importantly, the doctors will question our incompetence level. How we will make it through the day? They will leave in the middle of the training. Inga was very confident, and to my surprise, it worked. We really are true experts on the field and began to take part in the teaching, not just as translators, but also as teachers. She gave me the pain management part, the first part of pain management. And I would say that all of the experiences what I had with my son, the nurses understood really quickly that how is it important to do some protocol regarding pain management. So this is the map of the country, and then you can see the east part is trained now. And now we started to discuss it with the president of the Hungarian Perinatal Society and with Inga to do a research to make comparable studies that how it's working on the, to make a study that after the training, how the NICUs are working, comparing those NICUs who haven't done the trainings yet. Despite low staffing levels and varying space, some units are old and cramped, while others are new and spacious. The response across the region has been enthusiastic, and we are already hearing about taking steps spreading ideas, for example, good positioning to make children more stable. And as I mentioned you in pain management, the hardest challenge is still the inclusion of parents in baby care. Restricted access is often justified by fear of infection, as Inga mentioned. But we had several Hungarian units, Debrecen, Veszprém, Miskolc, that set a good example, as also Inga mentions, with the pioneers, despite limited space, making parents welcome, supporting opportunities for them to participate in their baby's care and to be close to their baby. These units do not demand the parents be completely covered, but they do have high standards of hand hygiene. 11 units are given unlimited access to parents out of 21 level 3 NICUs, which is a huge success, I would say. When we started to work with the association 4 years ago, we had free family-centered care in Hungary. These units made extremely good work, a lot of adjustment and change in their daily routine to make it happen. Observing babies, the level 2 FIND program started a bit difficult, mostly because all participants lost in translation. At the end of the course in Debrecen and Nyíregyháza, Inga adjusted the program, so the second FIND level 2 training, running currently, much smoother than the first one, and normally had to finish it next month. Well, now we know that this is not going to happen, so it has to be delayed. During 2019, last year, the association made enormous lobby efforts within healthcare politicians to implement the European standards of care, to get evidence-based supplementary training for the professionals, and to get their support to achieve 24/7 access to every NICU in Hungary. The family-centered care, nutrition, and patient safety topics from the standards are in line with the aspiration of the Hungarian government. Standard would have fast and visible positive effects on the Hungarian premature care. We had been invited by Dr. Yes, you can see Dr. Ildikó Horváth, she's the Secretary of State for Health, and then Gabriella Bábiné-Szotfried, she's the President of the District Nurse Division of the Medical Association. And we had follow-up meetings with Ildikó Lelkes. She's working as head of health policy department, no, head of Department of Family Policy, and Sebestyén Bea, she is the head of the health policy department from the Hungarian Ministry of Human Capacities. In the meantime, Budapest in November in 2019, we hosted with the Help with Semmelweis Unity the 7th scene symposium. And of course, with support of CNI. And the symposium was a success. We had 125 researchers from 24 countries, and had Hungarian health politicians were sitting together with the researchers and saluted all our efforts to implement the standards and assured us about their continuous support. And then by all of this work, this is what I think the biggest achievement, and this is my take-home message, that yes, parents can make the difference, as because by the end of the year, the Hungarian government announced the family-friendly obstetric program grant to support for family-friendly, family-centered obstetrics, newborn and premature intensive care with integrated infrastructural and equipment development and training programs, as well as the strengthening of programs to prepare expecting mothers. Within this governmental decree, you are listed as FIND training and family-centered developmental training. It's written FIND program. So the government is financing for all of the NICU who applied for the grant. We had the association help the head nurses and NICU chiefs to achieve a successful participation at the grant procedures with all of our best knowledge. They have time and financial support till the end of 2021. And the first trainings will be held at the Semmelweis University NICUs, all of the three of them, 2 maternity NICU and 1 surgical NICU, and one of the maternity NICU is my ex-NICU, which a few of you already visited last year. I think we were in the right time and the right place, and I'm so proud of our team. We were a few people at the beginning, and throughout the year we became a huge, strong team where parents are equal partners with the healthcare professionals. Thank you for your attention.